All right, let's jump right in. Have you ever gotten a pathology report and just stared at it? It can feel like it's written in a completely different language, right? Well, today we're going to create a kind of field guide, a simple way to translate all that jargon. We're going to help you understand exactly what the experts are seeing when they look at tissue from the colon.
So, it all kicks off after a colonoscopy. Your doctor takes this tiny piece of tissue, a biopsy, and it goes on a little journey to the lab. And that's where a pathologist takes over, putting it under a powerful microscope. But what are they actually looking for? I mean, what secrets can one tiny piece of tissue possibly hold? That's the big question we're diving into today.
Okay, first things first. Before we can start decoding any kind of diagnosis, we've got to learn the lingo. Think of this next part as our quick vocabulary lesson. It's the foundation for, well, everything else that follows. So what is pathology, really? At its core, it's the science of figuring out what's going wrong in the body. It's all about zooming in, way down to the cellular level, to find the root cause of a disease. I love this analogy. Think of a pathologist as a super specialized medical detective. Their microscope is their magnifying glass, and our body tissues hold all the clues.
Now, this is maybe the most important concept we'll cover. This is the fundamental fork in the road for any diagnosis from a pathologist. It's the very first question they have to answer. Is what they're seeing non-neoplastic, which basically means it's not a tumor, it's something like inflammation or damage? Or is it neoplastic, which means yes, there's an abnormal growth of cells, a tumor. And believe me, that one distinction, it changes everything.
All right, let's head down that first path. We'll start with the non-neoplastic stuff. And this is a big deal because it's often a huge relief for people to find out that not every issue discovered in the colon is a tumor. A lot of the time, it's something else entirely.
So if your report comes back and you see that word non-neoplastic, what does it mean? It means the pathologist saw something wrong, for sure, but the problem isn't caused by runaway cell growth. Instead, the tissue is just reacting to something else, maybe an injury, an infection, or some kind of inflammation.
And here's a perfect example to make it crystal clear. Ischemic colitis. When a pathologist looks at this under a microscope, they see tissue that's clearly damaged. But the cause isn't a tumor. It's more like a plumbing problem in your body. Not enough blood is getting to that area. And you can see why this matters, right? The treatment, the outlook, it's completely different than it would be for a tumor.
Okay, let's switch gears and cross over to that other path, neoplastic findings. So now, yes, we are talking about actual tumors. But, and this is so important, I need you to hear this, the word tumor does not automatically mean cancer. In fact, the vast majority of them are what we call benign.
Yeah, this is the definition you're hoping for. A benign tumor is basically a growth of abnormal cells that are, well, they're pretty well behaved. They might grow a bit, but they stay in their lane. They don't invade the tissue around them or go on a road trip to other parts of the body.
And you know what? There are a ton of different kinds. You'll see all these wild-sounding names on a report. Hyperplastic, hamartomatous, submucosal lipoma. Don't let the words scare you. They're just how pathologists classify what the cells look like and how they're organized. You can think of them as just different flavors of these benign growths.
So, what's the big takeaway here? It's really simple. Even though all those fancy names mean a tumor was found, let me say it again. They do not mean cancer was found. It's an abnormal growth, sure, but it's one that's usually totally harmless once it's taken out.
And that brings us to our last and obviously most serious category, malignant tumors. Honestly, these are the whole reason we have things like screenings and biopsies in the first place. Really getting what makes a tumor malignant is the key to understanding why pathology is so incredibly important.
Here it is. This is the big dividing line. Remember how benign tumors stay put? Well, malignant cells are the total opposite. They're invasive. They're designed to break out of their original spot, burrow into the tissue nearby, and even travel to faraway places in the body. That behavior, that is the very definition of cancer.
You know, cancer doesn't usually just pop up out of thin air. It often follows a kind of progression. It might start its life as a benign growth, something like a tubulovillous adenoma, but then, over time, things can change inside that growth, causing it to flip a switch and become malignant, turning into something like a mucinous adenocarcinoma. The pathologist's crucial job is to figure out exactly where on that timeline a specific growth is.
So when you hear people talk about colon cancer, 9 times out of 10, this is what they're referring to, colon adenocarcinoma. That's the official name for the most common type of malignant tumor in the colon. And it's the specific target that all this screening and testing is designed to find, hopefully as early as humanly possible.
Okay, wow. We've gone on quite a journey here, haven't we? All the way from simple inflammation to malignant tumors. We've learned this whole new vocabulary: non-neoplastic, benign, malignant. So after all that, what is the single most important idea you should walk away with?
It's this. Classification is everything. Knowing the difference is what it's all about. Hearing a word like neoplasm can be terrifying. I get it. But pathology is what gives us the power to put a label on it, to classify it. It's what tells us if this is something we just watch, something we need to remove, or something that needs a serious fight. That complicated language on your report, it's not there to scare you. It's there to give you answers, to provide absolute clarity. It's designed to turn that fear of the unknown into a clear plan, a path forward.